just want to thank everybody for joining us this evening. I am Lisa Valerio, the founder and president of the Phoenicia Foundation. On behalf of myself and the board, we'd like to thank you for listening to this webinar that is part 4 of a 6-week series on the important role of nonverbal communication. This webinar is presented by 2 amazing and passionate speech pathologists, Luna DeCurtis and Dawn Ferreira. Part 4 will cover the therapeutic intervention of nonverbal communication deficits. This series would not be possible if it wasn't for our sponsors, Silicon Valley Bank Foundation and the Lewis Greenwood Foundation. Phoenicia Foundation is honored by their support and all of our volunteers and donors who help us achieve our mission of helping special needs children, their families, and their communities thrive. If you're interested in learning more, check out our Facebook page and or our website at phoeniciafoundation.org. Thanks again for listening, and I am now going to play the pre-recorded webinar that Dawn and Luna has put on for us.
In our series on nonverbal communication, today we'll be talking about therapeutic interventions of nonverbal communication deficits. We started with part 1, talking about what nonverbal communication is and why it's important. And in part 2, we talked about what it looks like across the lifespan. And in part 3, we talked about the breakdowns that happen in nonverbal communication in different populations. Now we'll be talking how we use it in therapy as speech language pathologists and how we encourage the children with whom we work to use it and understand it. We first start with just general behavior skills. We use nonverbal communication from the get-go to just greet them with a simple wave and not overwhelm them with language, to connect nonverbally with a smile or a thumbs up. Maybe we gesture for them to come here, sit down, right? Just wait a minute, or just look what I have, right? Get them excited for what's to come. All of this happens non-verbally, so it gives the child an opportunity to keep calm and connect with us without any pressure of using words. How do you use nonverbals, Dawn, to set the tone for their behavior?
Yeah, so when a child comes in for the first time, they're in a new environment with a new person, I like to sit parallel to that child. I don't speak much. I will imitate a child's nonverbal gestures, such as playing with a car or building a tower with blocks, and I will establish eye contact. Now, the purpose behind this is that it really reduces the sensory input that the child is receiving, especially the auditory. So I won't start talking right away, but I really want to get the child's attention, and I want to do that non-verbally so they don't feel overwhelmed. It also shows that I'm taking the child's lead, which can really empower the child and send the message to the child that I'm really paying attention to you. You're important, and what you have to communicate has an effect on people around you. What about with delayed talkers and signs, Luna?
Well, for the little ones, when they come in and they're not using words, we want to let them know that their behavior is communication. And if they kind of move away because they don't like it, we teach them to say, oh, stop. No, you don't like it? Okay, no. Or if they're reaching for something, maybe we teach them to say, oh, me, mine, or more. We teach them American Sign Language to ask for more, or maybe we just pair our language with gestures to say, oh, do you want something to eat? To help the child use a simple gesture. And this one gesture can mean, yes, I want snack. We teach them meaningful gestures such as all done, or we teach them help. And although these are part of American Sign Language, we're just using it to bridge to language. We also use it to help them understand language. We use it when we're asking them questions. Who is it? Or where is it? There it is. We naturally pair it. And the nice thing is once we take away our words, they can then use that gesture to mean the question that we're intending. They learn to also maybe follow directions using our gestural prompts, such as you have to do two things, first this, then that. And if they aren't able to actually do both things, we might remind them with a simple gesture, right? Cue them with a simple gesture to say, or even cue them with a facial expression that we're confused about what they just attempted to say or do. As if to say there's something missing. How about with expressive language, Dawn?
So a lot of children that we see are emerging talkers, which means that eventually they will use verbal language as their primary means of communication. But it's very common for us in those situations to use a lot of nonverbal communication as well as teach the nonverbal communication. Because before the words come in, we have to have some system for that child to reliably communicate with their family and the world around them. So it's also very common for parents to say, why are you teaching my child of sign language? I want my child to talk. And because speech is really essentially a fine motor process, and that develops a little bit later than gross motor processes, it's easier to teach a child how to use a sign with their hands than it is for them to say the word more, for example. So we want to give them an expressive means of communicating right away. And often they can imitate our gestures before they can imitate our words. That takes nothing away from the goal of eventually creating expressive verbal language, but it really does help with the comprehension, one, as Linda talked about, and two, with expressive communication. So very important. We'll often use PECs, picture exchange communication, photos, line drawings, objects, a dedicated talker, different apps, all these things that will help support those who would eventually become verbal communicators, right? Now, there are some rare disorders such as selective mutism where a child is able to be verbal in very comfortable, familiar situations, but then out in a social communication such as school or out at the park, the child has a very difficult time accessing their verbal language. So we will develop a nonverbal system for the individual with selective mutism to communicate when out in the environment. It could be a simple picture board that they could point to. It could be using one of the AAC apps. It could be writing down if the child is already writing and reading. It could be also teaching that child to use very specific gestures so that they can still communicate even when they don't have access to the verbal language. There's another disorder that we often see, and that's nonverbal learning disorder. And for those individuals, they have difficulty recognizing, interpreting, and understanding nonverbal communication. And we often see this in older children. And for those circumstances, we will really emphasize using nonverbal communication and drawing attention to the nonverbal communication, whether it's the face or the hand gestures or the body language, and really specifically teach the meaning with that. What about for speech and articulation, Lina?
For speech, I'm always trying to get the children to focus on the mouth so I can show them where sounds are made in the mouth, right? A K maybe is back there to show them how my lips move. When I'm trying to protrude them for an SH, or to show them how air comes out, or and I'm also trying to show them how to use all syllables in a word by clapping them out. So a word like crocodile, I want them to hear the sounds, but I also want them to see my clapping so that if they only use 3 sounds and I want them to use 4, I can use the cue to get them to know, oh, there's more sounds in there. Also, just fluency, maybe drawing out the words that we're working on, maybe the rising intonation for a question, just using a gesture to let them know that at the end it goes up. And I'm doing this sometimes without using the words so that they can self-monitor and they can self-correct. How about with reading?
Yeah, there are some children who are learning how to read who are using multi-sensory programs such as Slingerland. Slingerland combines auditory, visual, and kinesthetic methods for teaching sound-symbol relationships. Now, the purpose here is that, the whole body is engaged in learning. And the nonverbals that are used, the gestures that are used to support and emphasize the sound symbol relationship is really helpful at triggering the memory, the recall of that letter and that sound that go together. So that tends to be very effective for many children. Also children and adults that demonstrate word finding problems, language formulation issues, cueing and prompting non-verbally really gives that extra processing time to allow access to what one already knows, but has a very difficult time sometimes having it immediately available. And again, for both children and adults, we don't want to bombard them auditorily. With adults, if they've had a stroke or a traumatic brain injury and they've lost the ability to easily retrieve information quickly, this, again, using gestures and allowing for that longer processing time can really facilitate retrieval. So providing feedback on what their nonverbals are communicating is also very helpful. I can say something like, I see that you're interested in reading a book on that table. If an adult who does not have access to their expressive language is looking at a book, I'm reading their nonverbal communication and then applying language to it. So, Luna.
Finally, using it with parents can be very effective by giving them cues to wait, to just watch, to just keep silent, as a form to help the child be able to come up with it on his or her own. So a lot of times we tell the parents from the beginning, watch our cues with the child and you can follow those. But we'll let the parents know we might be cueing you to, not say anything, don't do anything, just wait to see what happens. Now, please come back for part 5 in our series, which will be on the nonverbal communication for social purposes. Thanks so much. Bye-bye.
Thanks, bye.
Thank you all for attending, and I look forward to seeing all of you next week. Take care. Have a good one. Bye-bye.